hear me? So I've got to put it in place. Yep. Okay. So I will start. I'm Robyn Gennari. I'm the Staff Health and Wellbeing Lead at Royal Surrey. I've been working there since March 2022. So just to give you a bit of backstory, Royal Surrey is an acute trust. Our main site is at Guildford, and then we've got some community hospitals as well, and lots of additional services that we run across the Guildford and Waverley area. So for some of you who don't know, very leafy, very affluent area, which I'll come back to a bit later on. So one of the things that we do, Holly and I run the health and wellbeing service for all our staff, and one of the things that we had spent quite a lot of time focusing on was mental health, financial wellbeing with the cost of living crisis. And then what we realised we needed to do is start looking at physical wellbeing and looking at social wellbeing, because our service is categorised by those four key areas: financial wellbeing, psychological wellbeing, physical wellbeing, and social wellbeing. So they're the four key areas that we focus on, and we focus so much for probably over a year on the first two because they were really key during that time. And so I had a chat with our director of HR, and he said, Robyn, we really need to focus on some kind of event, something to do with physical wellbeing. So we went along to the Wellbeing conference. Where was that? In London?
Yeah, it was in London.
Yes. So and you know what it's like when you go to one of these wellbeing conferences. You're there's lots of halls. It was like one of the events, and there's so many stalls. You're walking through. You're looking at lots of. You're kind of bombarded by all of this information. And I was kind of looking around, not looking at anything in particular. And we came across the Myles Wellbeing stand, and it's quite funny because I think we were actually nearly leaving at that point. And so Marcus, we had a chat, and I was explaining, oh, actually, that's really interesting. We're looking at doing something about physical well-being. And it was just something that Marcus was talking about with regard to Myles Wellbeing, but that just really clicked with what actually we were looking to do. Because one of the things that attracted to us was the kind of social camaraderie, so like the competitive that you could factor into different teams. So that was something that I thought, oh, that's a bit different. A bit of competition to kind of promote the social wellbeing side, along with encouraging people to kind of focus on their physical wellbeing. We've done quite a lot of work on stress and burnout, and I thought this was a way of us kind of focusing on self-care. What do you do? We've got a lot of nurses, HCAs, porters that are doing so many thousands of steps each day, but actually how we're kind of focusing it on well-being, on their physical well-being. So this was something that kind of really just we were in the right place at the right time. It was something I was starting to look at, but probably wasn't quite clear on what I was going to be focusing on. So we kind of had a chat, but one of the things that I said, quite honestly, and as you will all know, is that NHS wellbeing isn't particularly well funded for staff wellbeing. Lots of nods. So it is historically not something that the NHS focus on, sadly, especially considering we spend so much time and money trying to do the best for patients, but we're not actually looking at the staff looking up to the patients. So that's kind of one of the things that I needed to gauge, really. I really wanted to commit to Myles Wellbeing, but I had to be realistic about whether or not this was going to be something that the board were interested in. And also, I didn't have a budget to cover it. So that was one of the things we first looked at. So I was honest with Marcus about that from the start, wasn't I? At the stand. So he said, okay, well, let's have a chat. Let's see where this goes, and we can see what we can do. And we came to an agreement that we would do a 3-month pilot, because what that would do was give us the opportunity to gauge the engagement, see whether staff were actually something that they would be signing up to, something that we could look at. Now, one of the other things that I knew was going to be really popular with the board and with the senior leadership, because we've done quite a lot of work on like the cost of living crisis and financial wellbeing, was the vouchers that you could accrue, the smiles that you can accrue. So I knew that was going to be a really good buy-in as well for me to be able to feed that back to people at the trust. So we started the pilot. We were quite sensible. You know what it is also like whenever you do these wellbeing initiatives for staff, you're kind of like really, we were thinking maybe like 200? We were like 200 people sign up, that'd be quite good. Absolutely smashed it. It was like we were meeting regularly, weren't we? So it's kind of chatting, and I'm like, wow, actually we've got really good engagement with this. And then we go out, let's double that, let's go with 400. Absolutely smashed it. And then I was like, because we'd reached past our 5%, hadn't we, target. And what really surprised me was actually how many people were engaging with the app, how many people were logging their activity either via their watches. And then the other side that kicked in was the camaraderie. They're like, oh, look, this person has done look how many smiles that they've accrued. And I was having people coming to the cabin and saying, oh, Robyn, I'm really sorry, I did mean to give you a high five, but I actually promised a high five to someone else, but I'm going to give you a high five tomorrow, which is, I'm sure you'll go into detail about. It might not make sense now, but and it became really competitive, and people actually coming up to me and actually saying, Robyn, I will give it to you tomorrow, but I've got to give it to someone else, and someone else has given me one, and I owe them. And it started conversations. You had people in teams going, how did you get that many points over the weekend? What were you doing at the weekend? How did you accrue that many points? And the improvement factor, you're like, well, I don't have that as many points as that person, but look at my improvement percentage. And it started kind of all those conversations. So I think that was something that really surprised Holly and I, so that actually how many people were getting involved, how many people were interested, and how the conversations were starting. People were getting quite competitive, definitely. I had someone coming up to me constantly saying, oh, I haven't logged this, because they didn't have a watch or a tracker. So you had the opportunity to individually put it in. And they were like, oh, I haven't done it. I've got to make sure I do remind me. I need to log so I can get my smiles. So really that was kind of the factor. And what that's managed to do with conversations with marketers is for us to be able to gauge. We can gauge the engagement. We can gauge the interest. We're able to look at the impact analysis. So with all the data that Myles Wellbeing have, as well as matching with our data, so our kind of like staff sickness levels and how we can do it. So we are at the case now where we've done the pilot, and we're now ready to put all of that information in together for a business case. Because again, as you know, we don't have a lot of money, but we are really lucky, and that's why I said earlier we're very fortunate. We work in an affluent area, and we're really lucky with our charity and our charitable donations to the trust. So what we will be doing is putting a business case together for our charity to be able to support them, so that we can continue the good work that the engagement we've had with Myles Wellbeing.
Thank you. This one? Yeah, brilliant. Right, so as Holly was saying, in this sort of 3-month period, sort of a really short time, we've managed to have a really big impact. And the first thing I want to share with you is our impact report. So these impact reports are things that we share on a monthly basis with our clients, just to give a sort of high-level view on what the impact is in terms of things like activity levels or engagement or interactions between users. So we'll just go on to the next slide. You can see, as Robyn said, we have absolutely smashed it with the numbers of users. So we've got over 680 users on the app, and that is constantly growing day by day. In terms of the engagement and how often people are accessing the app, we can see that people are accessing it 18.7 times on average in the last 30 days, which is pretty much exactly where we would want that number to be, because what we don't want is people on their phones doom scrolling all day, not getting anything done like we would do on TikTok or on Instagram or something like that. What we do want is people to be engaged, and we check and seeing how the colleagues are getting on, or seeing how many smiles they've got in the last day or the last week or whatever it is. So the fact that people are checking it that many times is brilliant for us. We then start to see some massive numbers. So in terms of the steps over this 3-month period, there's 680 plus people have done 211 million steps. In terms of the number of activities reported, 41,239. You then look at the distance travelled. So, I mean, this bag fits on there. So 163,241 kilometres travelled. And to put that into perspective, that is 4 times around the equator, or 43% of the way to the moon. So hats off to you guys as well. Sorry for doing that. It's an incredible achievement. We then look at the hours of activity. So it's not just people are doing the activities, they're also doing it for a decent length of time as well. So 13,256 hours of activity. And again, a bit of perspective behind that. That is 1.5 years, or for any of you movie buffs out there, 4,418 times watching the Titanic. Now, I know it's a good movie, but I'm not sure I can sit through it that many times. On to Holly's point around the high five. So the high five is a little social element within the app. So essentially it's a way of giving people kudos and saying well done for the efforts that you're doing. So you can click on somebody on the leaderboard, give them a high five, they will get an extra 100 smiles in their wallet, and they also get a load of confetti on their screen in the app, just to show that you're encouraging people to do that little bit extra and recognise them for the effort that they've been doing. And then all of this combined, all of this stuff that we've got, leads us to one of the sort of most important factors for us, which is the 2.6 times more physically active. So that is 2.6 times more physically active in November than prior to using the app. And this is a trend that we see across a lot of clients as well. So our mission is to get people moving more. You can see there, that's exactly what we're doing. Now it's great to get sort of figures like this and stats like this, but what's also really valuable to us is the qualitative feedback from users of the app. So just got a few quotes here. So first one, made me motivated to work out and exercise more for a better, healthy me. Great motivation at a hard time. I think Robyn and I were talking, this was during the doctor's strikes, the industrial action, so obviously that was a hard time for a lot of people. Very glad that we were able to help and keep people moving during that time. It's a very good app, I mean, very to the point. We usually like a bit more meat on the bone with the bits of feedback, but good to know nonetheless. Enjoy the motivation to hit targets and competition between teams. Good at getting you motivated and improve fitness. Really easy to clock up the smiles and get vouchers from stores that you actually go to. Brilliant. I mean, as you can see, as I mentioned, getting people moving more is our mission. As you can see there, people are motivated to do more, getting out there and do more activity, which is exactly what we want to see. Robyn, I think you've got a few little bits as well.
Yeah, I mean, I think definitely one of the things I'm most attracted, people come and tell us what they think of it. It might be when I'm queuing in the canteen, or it might be when we're doing one of our drop-ins and we kind of will plug it. We've got a really active community hospital. They're quite active, a few key ones of them. So straight away I was on it. I was like, you need to get on to the Myles Wellbeing app, and we were like spreading the word. But I think for some people, the feedback that they would give is that it just kind of gave them something else to focus on. Quite often, you can imagine when you're in industrial action or something, you don't really have anything else to talk about other than just how busy and stressed work is and da-da-da-da. And actually, this was a really nice way, by giving someone a high five for their improvement rate being so high, it started that concept, thank you so much. You know, people would email if I gave them a high five. So I knew that was the feedback that they were giving each other. I was able to kind of find out conversations that people were having with each other about it, just about how helpful, how they hadn't maybe spoken to that person for a while, and they noticed that they were higher up in the leaderboard. It started that conversation. So it's kind of ticked both boxes for us. We've got people talking more, talking about something other than how stressed they are at work, but equally kind of having that competitive side, and they quite liked that. I am actually really proud of us for getting those stats, I have to say. But yeah, kind of like more about, you know, when I would promote them, they'd say, oh, that's really nice for us to actually. Also, one of the biggest things was the vouchers that you can accrue from it. That was something that was absolutely huge to quite a few of the staff, particularly people that are gathering steps just from doing their day-to-day work. They were almost being awarded for the fact that they were doing those steps in their, 12-hour shift or something. So that was something that people did thank us a lot for as well. So yeah.
Good. Now with all of this sort of the facts and figures and the quality data we've got here, it is all really valuable, but again, I'm speaking with Robyn and speaking to other trusts that we're working with. If you're then going to go to a CFO or an exec board and say, hey, I want to use Myles Wellbeing because of all these stats and these great things people are saying, that's not going to be enough. So what we did was we went away and we said, right, how can we prove the value of the app? So we went away and we looked at a bunch of really reputable sources like the British Heart Foundation, NHS Digital, Public Health England, and Mercer, a big professional services company. And from that data from all these sources, alongside obviously the data that we collect within Myles Wellbeing, we were able to sort of come up with cost-saving estimations across two areas. The first one, so we know physically active workers take 27% fewer sick days. And through the data we've taken from these sources and within Myles Wellbeing, we estimate that we could reduce spend by up to £5,200 on sickness and absence. We also know retention, turnover is a massive thing. It's in the NHS long-term workforce plan. So we thought we need to look into that into more detail as well. And from those data points and what we have to add into that, we would estimate that we could reduce spend from anywhere from £2,100 to £4,700 per month. Now, you're probably all looking at me going, where the hell are all these figures from? And do sort of rest assured, I've taken Robyn and Holly through these impact calculators where we follow very logical sort of steps as to how we got. It is logical, isn't it? I'm glad you said that. So we do have impact calculators, which I'll be very happy to take any of you through as well, just to show you the type of impact we can have. Yeah, I think the fact that we've been able to sort of get to these figures, which are going to be put in front of the exec board and the charities, is very exciting for us.
Yeah, and I just wanted to kind of add to that. One of the things for our trust, I'm sure probably is the same for other trusts as well, our two highest rates reasons for sickness or going to occupational health is MSK and mental health. And so that's also going to be fueling part of it, is that actually significantly higher than other areas. Here is something that can actually help. Here is something that can target, both of them. Going out, part of it, people started going for a walk at lunchtime just because they wanted to get their steps in or they wanted to put it down on their tracker. That type of thing is going to improve their mental health as well as their, anything to do with, MSK, whatever, it's quite broad. But, there are two key areas, so that's definitely something that we're going to be feeding in.
Right, well, I think that's everything I was going to take you through, so it's quick, short and sweet, I think.